On.
Welcome everybody to this webinar, with today's title being Understanding the Effects of COVID-19 on Seafarers. My name is Michelle Grech from the Australian Maritime Safety Authority, and together with Christine Field from Hunterlink, we will be moderating this webinar today. This webinar is hosted by the Australian Maritime Safety Authority and is similar to a webinar hosted by the World Maritime University 2 weeks ago, which was carried out in European time. And considering this is an international collaboration, we thought it appropriate that we host the same webinar using Pacific time to give the opportunity for stakeholders on this side of the globe to also participate in this event. Before we start, I would like to explain the structure of today's webinar, noting that we have 2 live sessions and 2 recorded sessions. And due to time difference, most of our European colleagues obviously were not able to be physically present. This webinar will run for a total of 60 minutes. And no, there is a 20 to 30 second delay in transmission. So I'm a little bit ahead. This webinar hopefully will offer the opportunity for participants to engage with professionals and researchers who have examined the effects of COVID-19 on seafarers. We have 4 panels of researchers and professionals in this field who will contribute to the discussion. All the panels will make a short presentation, and after each short presentation, we might have the opportunity to take 1 or 2 quick questions. Note also that panel 2 and 3 are recorded sessions, but feel free to still post questions in relation to these sessions, as we can take these offline. And as this is a live event, please know that event questions will be moderated. During the presentation, you are more than welcome to participate and post comments and questions for all sessions, and engage with panelists, as well as with other participants. We will try and answer these offline if we are not able to do so during this webinar. After the presentations are done, we'll open the floor and invite questions from the audience. Myself and Christine will try our best to answer questions that come through and note relevant comments.
Thank you, Michelle. Today, I'm Christine, and I would like to introduce this first panel that we have today. Panel 1 is a joint research team from 4 universities: the University of Queensland, Australia, Royal Holloway University of London, UK, the World Maritime University, Sweden, and Uppsala University, Sweden. Panel 1 will present an initial analysis of a survey from international seafarers on the impact of COVID-19 on their mental health. Thank you, Dr. Michelle Grech.
Thank you, Christine. So this is the first time I'm actually presenting virtually, so please bear with me in this case. So I will be presenting the results of our recent analysis on the effects on seafarers experience the COVID-19 pandemic. As Christine mentioned, this was a joint international collaboration project with researchers from the UK, Sweden, and Australia, and included Dr. Birgit Paukstad, myself, Dr. Michelle Grech, Dr. Momoko Kitada, and Dr. Rika Bjerg Jensen. So the research questions that we focused on were the following. Firstly, how is the pandemic affecting seafarers on board international commercial vessels? Second, what are the effects on mental health and exhaustion? And third, what factors mitigate the effects of the pandemic? For example, what kind of support was available? But more important, what kind of support is needed? We collected the data through an online survey between July and September this year from seafarers who were at the time on board the vessel when completing the survey. The survey was distributed by social partners as well as maritime training institutions and many individuals and organizations in ports around the world, as far as this was possible. I would like to take the opportunity to thank all those who helped in distributing the survey, as well as the seafarers who took the time to participate in this survey. So the analysis in this report is actually based on responses from 671 seafarers. As you can see from the statistics, a lot of seafarers are officers with 72.5% of that population. Nationalities varied, with most coming from the Philippines, around 32%. There was also a large number of respondents from Northern European countries and also flex states from Northern European countries. So we realized that to some extent, this is not quite representative of the global fleet as a whole. Now, concerning the effects of the pandemic, most of the respondents experienced serious effects of the pandemic on crew changes, with 73.6% indicating a high extent. So ship-shore interaction was another area impacted heavily, with 47.4% indicating a high extent. Other areas such as employment, the seafarers' non-work life on board and getting supplies were also highly impacted by the pandemic. But there was almost a 50-50 split between those who indicated they were not or somewhat impacted and those that indicated they were impacted to a relatively or high extent in those areas. We had an open question about the difficulties and challenges during the last 7 days. The majority, as previously, with 66.1% of responses, again indicated crew changes as one of the main challenges. Respondents mentioned situations in which crew changes were delayed and or cancelled, as well as a lot of uncertainty around crew changes and difficulties related to traveling to and from the ship to home and vice versa due to visa restrictions, border closures, quarantine requirements, and flight cancellations. The other major challenges identified was in relation to ship-shore interactions, with 54.1% of the responses indicating that this is an issue. Taking shore leave was one of these issues, with seafarers also indicated that it was difficult or even impossible to go ashore for medical care, but even for personal purchases or for recreational purposes. This also negated the interaction seafarer would normally have with shore-based seafarer welfare providers. Related to this, respondents indicated it was difficult in some cases to get supplies, both for the ship, such as spare parts, but also supplies for the crew. Food was mentioned as an example. Another challenge that was mentioned was the situation on board. For example, in relation to workload and fatigue, with almost half of the seafarers indicating a higher workload than pre-COVID on board. The high workload and extended contracts and dealing with stress and negative emotions such as fear, anxiety, uncertainty, feeling locked in on board, as well as tension and sometimes aggression among the crew were also highlighted as some of the issues. And this challenge were also reflected in other questions that we asked about mental health. As you can see here, more than 50% of the respondents reported anxiety symptoms almost every day or several times a day in the last 7 days. Additionally, noting also in the results is that 50% reported symptoms of depression almost every day or several times a day during the last 7 days. And from a clinical perspective, these are considered to be quite high levels. Seafarers also reported relatively high levels of exhaustion, in particular feeling tired, exhausted, and having sleeping problems. And again, this was reported by more than 50% of respondents almost every day and several times a day in the last 7 days of the survey. So we also asked what kind of support was available as well. As you can see, there was almost a 50-50 split between those that indicated that they received a lot and or enough support, and those that indicated that they did not receive any or enough support. And the main sources of support mentioned was from family and friends and social media. And this to some extent highlights the importance of having internet connection or some kind of a connection on board. Another source of support that was mentioned frequently was the shipping company. However, when we looked at the type of support that was offered by the shipping company, this was in many cases mainly limited to advice, information, and recommendations on how to organize onboard procedures and precautions in relation to COVID. And however, these were not always easy to implement by the crew on board. Now we had around 50% of respondents that said they received help related to crew changes from their shipping company, but around 50% indicated that they did not receive help in relation to crew changes from their company. So we also asked about the kind of support needed, if anything. These were the responses, which include practical implications. The most frequently cited was related to crew changes, as previously mentioned. So for all crew members, regardless of nationalities, crew changes was actually quite important. So noting also that it was easier to arrange crew changes for some more than others. In addition, the aspect of having clear, simple and consistent policy and guidance in different countries and in different ports would be welcome. Access to internet and better communication while on board was also noted as something that's really needed. An important aspect that was mentioned was a change in negative attitudes towards seafarers who sometimes felt they were being treated as either dangerous or different from a negative perspective by local authorities they were in contact with. In this respect, they would like to be recognized as key workers to allow them to continue to do their job unhindered and be recognized for their contribution and the important work they do. Other support mentioned was in relation to getting supplies, facilitation of shore leave to allow similar access to shore-based workers to medical care when needed and supplies, but also for personal needs. Also, job security was another area mentioned, together with support from company in relation to information as well as mental health, which they wanted this to be extended to their family at home as well. So this was a very quick, short and sharp overview, which included some practical implications of the initial findings. Now we are now in the process of finalizing a report, which we hope to make available in the next week or so. I am happy to take some questions now, if there is time, or otherwise later. But also you can contact Birgit, who is the primary author, and I've got her email address there, and she indicated she would be more than happy to answer any questions offline. Finally, I would like to end by thanking those who had distributed the survey, but also the seafarers out there who took the time amid their difficulties and challenges to complete the survey.
Michelle, there is one question that has come up. This question is asked, did this mental health and fatigue issues increase the injury for LTI rates?
Yes, thank you for that question. So this particular study looked at exhaustion and mental health as an outcome. So we didn't specifically link that aspect with LTI and injury rates. However, we know from previous studies the effect of fatigue on these aspects, and we know fatigue is very much linked to accidents and injury, and mainly because of the effect it has on seafarers. So it's got the physical, the cognitive, and the behavioral effects, which ultimately people find themselves making more errors and potentially can lead to more dangerous situations. But for this particular study, we did not look at that particular link. Thanks, Christine. So we might actually, we've got a panel discussion later, so we can actually look at some of those questions later on. And feel free to also post any comments you may have in relation to some of the studies or any other comments you have in general. So we might move on to the next panel. So the next panel.
The next panel is from Solent University who will provide a preliminary analysis of a longitudinal study through survey with data collected from UK seafarers. Thank you.
Okay, hello, my name is Helen Devereux, and this is a project I have been working on with a colleague, Dr. Emma Wadsworth, at Solent University in the UK. And also need to mention that this is something we've been doing with the support of Nautilus International, the Seafarers Trade Union here in the UK, and also the Merchant Navy Welfare Board, which is the umbrella organisation for charities which support merchant seafarers as well in the UK. So big thanks to all of those people who've been working with me on this. So about the project, firstly, to say it is a longitudinal study. So what I'm talking about here are the preliminary findings from the first questionnaire. So this questionnaire was run between July and August 2020. And there will be a second questionnaire in early 2021. So we haven't determined the exact date for this yet. The reason being we were kind of waiting to see what was happening in the world. Things like the vaccine, how things are kind of changing with flights and this kind of thing, and what's happening to release it at a time when we thought we would get the kind of most valuable data. Okay, so this first questionnaire that I'm presenting, very much the preliminary findings at this stage. It is based on 216 respondents who completed an online questionnaire. So the questionnaire was primarily distributed .
Excuse me, I think I pressed the wrong button. This is the joys of technology.
Again, we've been doing with the support of Nautilus International, the Seafarers Trade Union for charities which support merchant seafarers as well in the UK. So big thanks to all of those people who've been working with me on this. So about the project, firstly, to say it is a longitudinal study. So what I'm talking about here are the preliminary findings from the first questionnaire. So this questionnaire was run between July and August 2020. And there will be a second questionnaire in early 2021. So we haven't determined the exact date for this yet. The reason being we were kind of waiting to see what was happening in the world. Things like the vaccine, how things are kind of changing with flights and this kind of thing, and what's happening to release it at a time when we thought we would get the kind of most valuable data. Okay, so this first questionnaire that I'm presenting, very much the preliminary findings at this stage. It is based on 216 respondents who completed an online questionnaire. So the questionnaire was primarily distributed via social media. I'm a former seafarer, I'm married to a seafarer, very much using kind of contacts and connections like that, things like Facebook groups and that kind of thing, and sending it as far as wide as we could. We targeted British seafarers, okay, so a bit different from the other questionnaires in the sense that ours is primarily for British seafarers, okay, and we gained respondents basically across the ranks and across the various sectors of the industry. So pretty much every sector that you could think of, we had some respondents from. Perhaps the biggest we got was cruise ship, interestingly. About 25% of our respondents identified as being in the cruise ship industry. Okay. And again, Nautilus and Merchant Navy Welfare Board helped us to distribute it by their channels as well, and thanks very much for that. So I am not going to go through all of the findings. I've got 7 or 8 minutes, so very much just kind of pick one key thing that's came that I and Emma found particularly interesting, and that is about the employment terms and conditions of the seafarers who filled in the survey, and how that their responses were different depending on this. So most of the seafarers, so 72%, described their contract as permanent, okay, and 18% said they had temporary or voyage contracts. If we look at the data that the closest data we've got with this is kind of very typical for UK industry. If we look at the sort of nationalities of seafarers, would be quite different. Okay, some nationalities much higher numbers of temporary employed seafarers, but for the UK, that's about representative, we think, at the moment. Okay, and how individuals were employed made a number of significant differences. So more seafarers with permanent contracts had been joining the vessel as normal. So 40% of seafarers with permanent contracts had joined the vessel as normal, compared to 10% who were temporarily employed. Fewer seafarers with permanent contracts had not joined the ship as scheduled and were not being paid. Okay, and fewer seafarers with permanent contracts had been made redundant or had not had a contract renewed. Okay, so very much those who were employed on a permanent contract had kind of less issues than those who were employed on the sort of standard voyage temporary contracts, if you like. Again, fewer seafarers with permanent contracts reported an impact on their finances, so 31% compared to 63%, and fewer seafarers with permanent contracts reported being more likely to leave the industry. Okay, so one of the things we were particularly interested in the questionnaire was about whether people would recommend the industry. Here in the UK, we know that there's a shortage, or there's a predicted shortage of seafarers in the coming years. I'm quite interested in whether kind of current seafarers are happy to recommend the industry to possible newcomers. And also not only recruitment, but retention. Okay, if the pandemic was more likely to cause seafarers, or less likely to leave the industry. And certainly on social media, what we were seeing was a lot of seafarers saying, you know, that's it, I'm not going back, I'm done with this, I'm finding something else, and that kind of thing. Okay, so fewer seafarers with permanent contracts report being less likely to recommend seafaring. Okay, so again, those who were permanently employed really, you know, more likely to recommend it and less likely to leave the industry. And fewer seafarers with permanent contracts reported an impact on their career. Okay, so those who were on temporary contracts, on voyage contracts, nearly 80% reported an impact on their career of the pandemic. So one of the things we were particularly interested in is the financial implications. So the UK is fairly unusual in the tax scheme that it's got for seafarers, in that the seafarers pay a significantly less amount of tax if they're out of the country for a certain amount of days. So obviously, with people not being able to crew change, these people weren't going to be out of the country and were therefore going to have to pay tax on the salary they'd already earned. But also particularly interesting, because many of the cruise ships have been laid up within UK waters, so not in port, but within UK within sort of UK water limits. Many of these seafarers are going to have to pay tax even though they'd actually been on board. So obviously there's quite a lot of disgruntlement about that. The UK government introduced, like many of the governments, a furlough scheme for workers in the UK in order to kind of protect jobs. What some of the seafarers reported, that they, due to how the furlough scheme was being applied, obviously it was predominantly designed for shore workers and sort of standard employment, they were going to lose money. So one hotel department worker, for example, reported having 80% of the basic salary paid only during the months that it doesn't support me, I've lost 2 months of wages already. Okay. Several of the respondents reported that they had job offers withdrawn. So people who were kind of expecting a voyage contract had then had this voyage contract withdrawn at the last second. So one deck officer on a general cargo vessel said, I had a job offer withdrawn in April. I spent 3 months unemployed before being offered a temporary contract with another company, but at approximately 50% of my previous salary. So obviously a significant financial implication there for that seafarer. And finally, an individual on a cruise ship reported that they'd had to seek additional employment to cover costs whilst they wait to be offered a new contract at sea, whenever that may be. I guess there's some quite serious financial implications, and these were felt, perhaps unsurprisingly, most heavily by those who were employed on temporary contracts rather than those that are on permanent contracts. Okay, thank you very much.
Okay, so we'll just move on to the next presentation, which is from the University of Zadar, Croatia. This is actually an international study which actually had 752 seafarers who worked on board as well as were at home during the April-June data collection period. So we'll just move on to the next one.
We will move to the panel 3, which is Dr. Anna Sliskovic. If you can share your screen, Anna. She's an associate professor, Department of Psychology, University of Zadar, Croatia. You can start the presentation, Anna.
Thank you, Momoko. Good afternoon to everyone. My name is Anna Sliskovic and I come from University of Zadar in Croatia. My research interests include stress in seafarers. The declaration of world pandemic in March this year prompted me to do this study in which I simply wanted to ask seafarers how are they. We all know, and in that moment in March this year, it was clear that preventive measures related to world pandemic will cause prolonged stay on board and at home for seafarers. Seafarers really should be recognized as key workers since they have an essential role in keeping the world moving. However, the question is, are they treated as key workers not only during this pandemic, but also during the normal circumstances? Actually, many studies which are done time before COVID-19 show that in spite of many advances in maritime sector, seafaring is still regarded as demanding, stressful, and high-risk occupation. So the Croatian old saying that seafarer life is a bread with 7 crusts is still a good illustration of their profession. Actually, seafarers face with many stressors in their occupation. Actually, this list is very, very long, and these stressors may lead to negative consequences on both individual and organizational level. So in this context, world pandemic imposed as an additional threat to seafarers' well-being. One Croatian seafarer said, "We now have one more crust named COVID-19." So the basic aim of my study was to describe well-being of seafarers who are both located on board and at home in the context of this pandemic, while using their personal experiences as the main data source. Sample involved 752 seafarers from the international market. 40% of them were on board and at the time of participation, and 60% of them were at home. The sample was convenient, but it was also very heterogeneous regarding basic demographic and working characteristics such as gender, age, type of ship, ranks, nationality, and so on. I won't go in details with it. Maybe I can go back if anyone wants details. Data was collected in spring this year, and the questionnaire included one open-ended question. How does the COVID-19 pandemic affect you personally? Results show that almost all participants reported on extensions to their stay on board and or at home. They reported a range of different experiences, from not affected at all to mild effects, and some of them reported some serious negative experiences, but analysis show that majority of the participants reported some negative experiences. Thematic analysis showed that all these reports may be classified to 4 categories, to treat to mental, physical, social, and economic well-being. Here you may see some examples of reports of seafarers located on board. Analysis show patterns according to which prolonged working period, along with uncertainty about data leave, may lead to some serious consequences on mental and physical plan. You may see here examples of fatigue, lack of concentration, depression, anxiety, suicidal thoughts, and so on. But for me personally, the worst part of their reports were their feelings about being abandoned or forgotten by society. So I would say that their social well-being is being deeply shaken. On the other hand, seafarers who were at home during the pandemic reported mostly about their financial situation, which includes a lack of income, job insecurity, losing the job, and all this brings huge concerns to whole families. To conclude this short presentation, I would say that seafarers on board mostly reported about threatened social, mental, and physical well-being, and this have serious repercussions on for health, work efficiency, and onboard safety. On the other hand, threatened economical well-being reflects on health and motivations to work in maritime sector. In sum, I would say that seafarers who participated in this study describe their reality as far away from the concept of key workers. In spite of providing a vital service to the world, they do not see the respect of their human rights. My main question is, what has changed since spring? Well, for months, international maritime and transport organizations were lobbying governments for revised regulation, which would enable crew changes. However, in spite of many calls and recommendations, in this moment, thousands of seafarers are stuck at sea for endless months, and in some cases more than a year. That's all for me for now. Thank you for your attention.
Okay, so we might move to the next panelist, which is the final panelist in this session. So panel 4 will be presented by Christine Field, who is the CEO of Hunterlink. And Christine will share the impact that COVID-19 is having on seafarers from information collated through mental health specialists that are counseling seafarers on arrival in Australia. Over to you, Christine.
Thank you, Michelle. Really appreciate being here today. So hello and welcome to Huntlink's panel discussion on the effects of COVID-19 on seafarers' mental health. I am Christine, the Chief Executive Officer of Hunterlink, an employee assistance program provider that specialises in the maritime industry. We provide 24/7 mental health and wellbeing support via our national phone line 1800 554 654. Hunterlink was founded 10 years ago as a not-for-profit rehabilitation and counselling service for maritime workers. We have since evolved to become one of the leading employee assistance programs for the maritime industry. As part of our suite of services, through support from the International Transport Federation Seafarers Trust, we are able to provide 24/7 year-round mental health and wellbeing support to any international seafarer in an Australian port. This service is at no cost, and we can provide translation services as required. Hunterlink is also a member of the Australian Seafarer Welfare Council and local port welfare committees, providing mental health and wellbeing advice regarding our work with international seafarers. Today, my focus is on the impact of COVID-19 pandemic on the mental health and wellbeing of our international seafarers. 2020 has been a difficult year due to the COVID-19 pandemic. In Australia, we commenced the year with bushfires that saw Australian maritime workers assist in the rescue efforts of many. Hunterlink was there providing phone counselling and support as required. Bushfires were overtaken by the pandemic that was sweeping our globe. Since January, there has been a 50% increase for mental health and wellbeing support through Hunterlink that has seen on average 18 calls a day from individuals seeking help, with a majority of these callers from the maritime industry. We've also had a 20% increase in contact from international seafarers in distress, many presenting with suicidal ideation, which is the thought of and plan to suicide. Today, I'll briefly present 4 cases. Of these cases and the many that contact Huntlink, the presenting issues are anger, anxiety, depression, grief and suicidal ideation, which is similar to what we've just heard in both of, in all of the other panel discussions that we've had. So our first case was a female who contacted via our WhatsApp number, who held serious concerns for her husband, who was an international. He advised her he was worried about his mental health as he wanted to return home due to notification that a family member was very ill. Unfortunately, he was unable to. She felt he was depressed and suicidal. Support was provided to her, however, no contact was made by her husband, and we do not know the outcome of that case. Our second case was a male who contacted via WhatsApp, who was 6 months over his contract. He presented with signs of exhaustion and heightened stress that affected his nervous system. He was also concerned for other crew members and mentioned suicide. Counselling support was provided to him. Our third case, a male who called through our toll-free number. This seafarer had severe anxiety and depression that was becoming debilitating, affecting his physical health. Our senior counsellor was able to provide a letter of support for repatriation, and that was mainly due to the serious nature of the issues that he was presenting with. The seafarer was provided ongoing phone counselling on the vessel and in the hotel while he was waiting his repatriation. I'll come to that case a little bit later in one of the other slides. And our final case is also a male. He contacted via our email, inquiry@hunterlink.org.au. He was 1 month over 11-month contract. He was suffering from loss of hope following other crew members' ability to repatriate and him being left behind. He also exhibited with severe depression. Contact was lost following his departure from Port Botany, and we have an unknown outcome from that individual. So from these cases, the counselling team at Huntlink have identified the following reasons for these presenting issues. They are isolation, uncertainty due to contract extensions, uncertainty due to changing policies and legislation that is nationally and globally affecting them, inability for repatriation, and the continued loss of hope. Now revisiting that third case, the individual was already suffering from debilitating depression. Through the support of Huntlink and working with the Department of Health here in Australia, the individual was able to be repatriated. This meant that after leaving the vessel, he was transferred to a hotel for quarantining. It was during his hotel stay that he soon realised his inability to return home promptly. This was due to the lack of flights and border closures for his country. He felt alone, which was impacted by no longer having the support network he has at work. His depression uncontrollably spiralled and his loss of hope intensified. This demonstrates the need for continued support if a crew member is repatriated, or even a greater understanding of the services that can be provided, whether it's via Huntlink, Mission to Seafarers or Stella Maris. At Huntlink, for every person we help, there are many more that are struggling in their workplace. This is very evident for our international seafarers. At Huntlink, we recognise the need for increased support. This can be through greater engagement and communication at the coalface to encourage people to call. Huntlink is aware of cultural sensitivities that surrounds mental health and encourages greater communication in this area by employers. Greater awareness is needed of mental health in the maritime industry, and we are grateful for the work that AMSA and the Australia Seafarer Welfare Council do, who recognise the need for discussions similar to the ones that we're having today. greater access to resources either at sea or alongside via free Wi-Fi, similar to the program that Seafarer Connect is rolling out nationally. This is what happens with Seafarer Connect is a Wi-Fi is connected on board, and when a seafarer logs on Connect, free Wi-Fi, they are taken to Hunterlink's website where they are able to access information about mental health and well-being in various languages. There is also the need for greater information that removes the stigma and judgment that still surrounds mental health, and understanding of the services that Hunterlink provides. So Hunterlink professionals can be reached 24/7 via our toll-free number 1800 554 654 or via WhatsApp, which is the preferred mode of communication by our international seafarers. And that is due to its confidential nature. Unfortunately, they're worried about anyone logging their calls that they have on board if they call directly, and they're also worried about people overhearing them. So by using WhatsApp, they know that there is limited chance for someone overhearing the nature of their call. They can also email as the inquiry@hunterlink.org.au. Our professional counsellors are fully qualified and they are there if you need to, just a general chat, just a quick download, or to provide for further counselling support. We're very fortunate to have the connection with many services in Australia that can provide that short-term but also long-term support for these essential workers. So thank you for today. Thank you for the opportunity, and I'm more than happy to answer any questions now or send me an email. Thank you.
Thanks, Christine. So thanks, Christina, for that. So I'll just check whether there's any questions. So we do have some general questions, so I might actually go straight to the panel questions. Okay. So one of the questions was in relation to were families a short survey to gauge their mental health, seeing that their loved ones were away from home for an abnormally long time. So I can talk for panel one. So with regards to panel one, what we identified is that seafarers actually identified this as a need. They did identify the need for not just mental health support for themselves, but also mental health support for their families who are ashore. So that was actually identified as part of the needs outcome when we asked the seafarer that question. So I'm not sure whether you have any more comments on this one, Christine.
That first case that I discussed was a family member. We have the ability for people to call, well, not so much call, but Facebook Messenger us, as well as utilise the WhatsApp service. And there has been several occasions where we have been supporting family members, and this is especially in the case of men overboard and suicides or accidents in the workplace.
Thanks, Christine. There's also another question which asks, has positive psychology been applied to support workers? So I suppose I can answer that from a research perspective and best practice from shipping companies, because this question came up also in the other webinar, and what we find is that there are best practice from a number of shipping companies. So there are shipping companies who actually are providing the right level of support, and they have dedicated people to do welfare checks and provide support. In our case, one of the aspects that came out in our study was that a particular company, for example, try to even organize quarantine for seafarers, so they can do it together. So for example, if a seafarer needed to quarantine, they actually got some seafarers together so that seafarers wasn't doing quarantine alone, wasn't traveling alone. So they kind of applied this concept as well. But we know that there are companies who are doing the right thing and providing the mental health support. but it's not widespread. So this is one of the issues that we're identifying as well. So I'm not sure whether you have any other comments on this one, Christine.
Yes, it just depends on the company. We have really proactive companies that we work with who do welfare checks regularly. They work with Hunterlink to provide as much support as possible to seafarers, but unfortunately this is not rolled out across.
Thanks, Christine. And we know, for example, that and leadership from senior managers and focusing on seafarer welfare as a top priority. To some extent, research has shown that putting well-being at the front end and looking after the crew also has significant impacts on safety outcomes, and we've identified that in previous research that we've done. So we do have a few more minutes. There isn't many more questions or discussions, but I just wanted to mention something that actually came up in the previous webinar. And one of the elements that came up is that this is a really unforeseen event, and there may be other unforeseen challenges in the future. So what can we learn, and how can we support our key workers moving forward in the future? I'm not sure whether there's anything you want to add from this perspective, Christine.
Just greater engagement and understanding about mental health and well-being. It's making sure that we're continuing to get the messaging out there that having your mental health is similar to having a physical health. And in the workplace where we look at physical hazards, we should also be addressing our mental health hazards, because by addressing our mental health hazards, it can have a really good impact on our on the organisation and the economy as well. So it's really important to get the message out there, reduce the stigma, and be really proactive in discussing mental health as just a normal part of everybody.
Thanks, Chris. And I think something that also was discussed between the other researchers is that this pandemic, to some extent, has also exposed some cracks and faults that may already have been in existence, and that the aspect of high workload and fatigue and its effect on mental health was to some extent already there prior to the pandemic. And this we know because we've done other research studies that supported this issue. And to some extent, what the pandemic has done, it has deepened those cracks and highlighted these issues more seriously than before. So potentially us taking a breath and having a good look at how we operate and ensure we are creating an environment for seafarers to be resilient and be able to go better under these situations now and in the future. And as you mentioned, this is not a localized issue. A regional solution is not enough. So it needs within country and between country global cooperation and collaboration in order to be able to work better to actually improve the situation in the future. So I actually might bring this webinar to an end, unless there's any other comments. I can't see any other comments or any other questions. But what I wanted to do is, I'd like to thank everybody for those people who participated in this survey. I'd like to thank Christine for being here with us and providing an insight into some of the real issues that are coming through from the seafarers themselves. If you have any questions, specifically in relation to each of the panels, please, you can contact them directly through these contact details. I'm not sure whether you can see the contact details. Okay, we've shown the contact details before and they're available on our website. But what I would like to do is I would like to thank all the panelists for the presentations, the one that were physically here and the one that were not physically here and probably are sleeping at this point in time. But noting also that we will be sharing a copy of the video and potentially some of the Q&A that came out from the last session. And so what I want to do is that's it for today. And I also want to thank you for taking the time to be with us today. Thank you.
Thank you, Michelle, as well.